Station 1. You are a medical student nearing the end of your rotations in a hospital. You notice a fellow student, John, who has been taking pain medication from the ward for his personal use. How would you address this issue?
So the main ethical dilemma in the situation is the fact that John is essentially stealing pain medication from the wards, which compromises his professional integrity, as well as it puts patient safety on the line too. This goes against the code of conduct that's expected for him as a medical student, as well as a member of staff essentially on the wards too. If we consider the pillars of beneficence and non-maleficence, the fact that he's taking medications from the wards that are meant for the patients on the wards as opposed to him can compromise patient safety as well. And this ties very nicely into the pillar of justice too, where we want to make sure that patients have access to resources that are meant for them on the wards, as opposed to John, who isn't a patient there, and he's taking these medications without being a patient at the hospital trust. So how I would approach this situation, first of all, is I'd want to talk to John. Since clearly he's taking this medication for a particular health problem, I'd want to, very compassionately, very empathetically talk to him about, why he's taking this medication. Really get to know whether, he's got any health problems that he hasn't spoken to anyone about, whether, it be things like, if he's got financial problems where he can't afford any other forms of medication, so he feels the need to steal them. So I'd really want to elicit those, and I'd want to let him know that what he's doing is very wrong. I'd remind him of our code of conduct as medical students here on the wards, and I'd ask him to, let a member of staff, one of our supervisors, know, immediately about, what he's been doing. If for whatever reason John refuses to tell our supervisors, then I'd have to let them know myself, let them know about John's behaviour, how he's been taking the medication from the wards without anyone's knowledge, and let them know too, as this goes against, again, the code of conduct and what's expected of us as future doctors.
Station 2. An unconscious 16-year-old girl arrives to A&E after a severe car accident. Her parents demand every intervention, but in the unlikely event she survives, she will be severely disabled. Explain how you would navigate this situation as a junior doctor.
So the main ethical dilemma that comes into play in this situation is respecting what the patient would have wanted, and also respecting the parent's decision as well. And it is a very difficult scenario to navigate as a junior doctor. Considering the state of the 16-year-old, the fact that she is a minor as well, and it's very traumatic for the parents too. So I'm going to start off by considering the pillars of ethics that come into play here. So if we consider autonomy, our 16-year-old patient, she is currently in a very bad situation. She's unable to make decisions for herself, let alone talk, most likely in the situation. So we have to presume what her wishes might have been. And it's unlikely that this patient would have an advance directive in place, assuming that she was fit and well prior to this accident. So we'd have to speak to her parents and find out what she would have wanted in the situation. And in this case, the parents are demanding that she receives every possible intervention in place that will help her survive. So considering the pillars of beneficence and non-maleficence, it's really important that we acknowledge that although the parents do want all these interventions, they might lead to a worse quality of life if she were to survive. She'd be, very disabled, unable to look after herself, and unable to really have a good quality of life. So we really have to consider that when looking at beneficence and what we're actually doing for the patient that will help them overall. So how I would approach the situation is I really want to, first of all, talk to the parents as much as possible. Let them know that if we were to give their daughter all these interventions, first of all, they might be very invasive and lead her with a worse quality of life after the procedures. She'd be unable to walk, talk, and do normal things that a 16-year-old would be able to do. So I'd really want to, discuss all the benefits and risks of all these interventions first with them in a very compassionate and empathetic manner. If the parents still continue If the parents still continue by saying they do want every intervention after you've, listed all their concerns and told them about all the benefits and risks, then I'd want to get a senior supervisor involved, since I am, first of all, a junior doctor. I'd want to talk to my registrars, my consultants, and get them involved, since again, this is a very complex situation. And it's also very important to bear in mind that she is a minor, she is 16, and if the parents are still continuing to pressure for things that go against the best interest of the patient, we might want to get ethics committees involved later on down the line.
Station 3. A pregnant patient requests an abortion due to a fetal diagnosis of a severe genetic disorder. Discuss the ethical issues that need to be considered in this situation and how they would guide your approach.
So in this scenario, we really have to consider the reproductive rights of the patient in her choice of whether to continue with the pregnancy or not, as well as considering the genetic condition of the unborn fetuses as well. So first of all, if we consider the pillar of autonomy, the patient is very much within their rights to terminate a pregnancy, since this decision is about her body and her pregnancy. And if we consider the pillars of beneficence and non-maleficence, we want to make sure that, whatever we're doing, whatever the choices of the patients are, that it's in their best interest. For example, the patient might not want to continue with the pregnancy because if they do have the pregnancy, they might not be able to look after their child because of their own physical conditions or their own mental health, or if they believe that their mental health would suffer, or if the unborn fetus's mental health would suffer as a consequence of the mother's social situation, for example. So it's very important to consider those two aspects as well. And finally, considering the pillar of justice, we need to make sure that the patient has equitable access to abortion services regardless of what their situation is too. So how I'd approach the situation is I'd want to have a very empathetic, a very compassionate conversation with the patient and let them know about the full diagnosis of their unborn fetus's condition, letting them know that if they were to continue with the pregnancy, these are the options available for their fetus in terms of treatment, management, if this is something that they want to consider. But then again, I'd want to support whatever decision they make ultimately. I'd also want to refer them to, for example, genetic counsellors, mental health counsellors as well, since if they did, for example, continue with either decision, it can be quite mentally draining, very mentally taxing and physically taxing as well. So I'd want to provide them with all the right support that they may need. And overall, I'd want to respect the patient's decision and ensure that I'm adhering to ethical guidelines surrounding abortions too.
Station 4. You're a medical student working in a research lab. Your mentor asks you to manipulate the results of a study to favour a particular drug being developed by the lab sponsor. How would you handle this situation?
So the main ethical issue that arises in the situation is upholding scientific integrity. So if we're manipulating data that's being used in scientific research, which is the backbone of how we come up with our treatment and our management plans, it really reduces the trust that researchers, patients, doctors have in this particular research. So if we consider the principle of integrity, it's very important that we remain truthful about the research that we're conducting and not manipulate results, and make sure they are as accurate as they can be for later use by healthcare professionals. And by considering the pillar of non-maleficence, we want to make sure that we're using true information as opposed to false information that is being used to come up with treatment plans. For example, if we're using false data as a means to justify particular treatments, we can actually end up with negative consequences for the patients. They may end up with side effects and all sorts of things as a result of scientific integrity being impaired essentially. And if we're considering the pillar of justice, all patients within the NHS have the right to receive healthcare, but also healthcare that's based off of fair and unbiased data, so they can receive optimum management and treatment plans. So how I'd approach this this situation is I'd very politely, but also very firmly, refuse this request to manipulate data, since it goes against scientific integrity. But I'd also report this situation to my senior staff members, senior colleagues, as it is very unethical and can have very negative consequences down the line. And if I'm continued to be pressured into doing this, then I'd seek advice from senior professionals as well regarding the situation.
Station 5. A patient refuses cancer treatment despite a high chance of cure. How do the ethical principles apply in this scenario?
So the main point to consider in this scenario is balancing what the patient wants for themselves and balancing, what we want to do as healthcare professionals, which is, to save their lives and give them this cure. This is unfortunately a very common thing that I saw during my work experience at the hospital, where although the inherent desire for doctors is to treat patients and give them medications, you have to respect what the patients want, which might completely go against what's medically right for them. So if we consider the ethical principle of autonomy, the patient is within their right to refuse treatment given that they have the correct capacity, or they have enough capacity to do so. To assess for capacity, I want to make sure that they're able to understand the decision that they're making, weigh it up, and relay it back to me. If we're considering the pillars of beneficence and non-beneficence, we may think as healthcare professionals, giving them the cure, giving them the cancer cure is what's in their best interest, as it will cure them of the disease. However, acting in their best interest also means that we have to respect and listen to their wishes of not being cured, as this is what they desire for themselves and what they believe will be better for them mentally, or whatever it may be. So how I'd approach the situation is I'd want to talk to the patient in a very non-confrontational manner, where I'm being very compassionate since the situation is very sensitive, and I really want to find out why they don't want the cure. Is it because they've had side effects previously with the medications that we want to give them? Is it because they don't want any invasive devices such as cannulas being inserted? Is it because they're in too much pain? I really want to figure out all the whys behind their decision making. Additionally, it's really important that I give them all the information regarding the consequences if they don't go through with the cure for the cancer. Really, let them know the process that happens afterwards. Additionally, I'd also want to consider alternative treatments that I might want to, give them, that might be, for example, less invasive, have less side effects. So I'd really want to have a very, long, thorough discussion with the patient. So overall, I'd really want to have a very long and thorough discussion with the patient, where I'm, respecting their decision, but also, documenting all the decisions that they're making, to make sure other healthcare professionals follow through with what they've chosen as well.
Station 6. During a medical school placement, you witnessed another student who is unable to pay for the hepatitis B vaccination for medical school. What would you do?
So the main issue here is the students' access to this very important Hep B vaccination, which is needed for them to complete their medical education safely, but it's also needed for the safety of patients that they're involved with. So the Hep B vaccination is something that's needed by all staff members involved in hospitals in order to prevent them from the transmission of this disease via needle stick injuries, for example. If we're now considering the pillars of medical ethics, the pillar of justice is very important here, because we want to make sure that the medical student is also receiving the right healthcare that's needed for them to continue in this particular field. So it's very important that they receive the hepatitis B vaccination here. But this vaccination also means that we're protecting not only the medical student, but also patients on the wards, so they're not transmitted hepatitis B from the medical student themselves. And this ties in very nicely with the pillars of non-maleficence and beneficence, since we're preventing disease and promoting health for not only the students but also the patients as well. So how I'd approach the situation is talk to the student in a very non-judgmental manner, where we're discussing, alternatives for them to be able to fund this vaccination to promote the safety of my fellow medical student and the safety of the patients that they'll be seeing in their education and beyond. Do I say too much?
Station 7. During your clinical placement, you encounter a patient who refuses to be treated by a doctor due to the doctor's ethnicity. How would you respond to this situation?
So the main problem here is the patient's refusal of seeing a doctor based off of their particular ethnicity, even though they're completely, qualified to be treating them. By considering the ethical principle of autonomy, although the patient here does have the right to say no, this does not justify their discrimination and their refusal of seeing a perfectly qualified doctor because they're a different race to them. And now if we consider the pillar of justice, the discriminatory preferences of the patient doesn't impede the fair treatment that they're receiving from a perfectly qualified doctor, and doesn't also impact the doctor's professional rights as well. So how I'd approach the situation is I politely but firmly explain to the patient that their preferences are quite discriminatory and there are particular professional standards in place, at the hospital and in this place of work. That means that we don't discriminate, and how non-discrimination is a two-way boat as well. That not just applies to doctors and patients, but also patients and their doctors as well. I also want to discuss further with the patient in, again, a very polite, non-judgmental manner about why they particularly feel this way, and try and facilitate their particular decisions in a different way, for example. And unfortunately, I've seen this case in hospitals and when I was doing ward rounds, where sometimes the easiest way is to actually, change the healthcare professional involved. Although, that is very sad, and we don't want to be promoting that in the long run. Sometimes in urgent situations, that might be the best case for the patient. However, in this particular case, I definitely want to get my senior colleagues involved and let them know so we can navigate this together. As if the patient is being particularly irritated or violent sometimes in this case, it's very important that we take the right precautions and take appropriate steps when addressing the situation.
Station 8. The headline states, CRISPR bombshell. Chinese researcher claims to have created gene-edited twins. Reports trigger shocked reactions and calls for regulation around the world. Discuss the ethical issues surrounding this case.
So this case involves the modification of these twins' DNA using CRISPR gene editing technology. And this raises particular concerns surrounding the idea of producing designer babies, which are essentially babies who've had their genes altered in order to fit the parents' needs, whether that be they be more intelligent and more physically better looking, for instance. The potential benefits that gene editing can have in a more medical stance, for example, editing out genes that lead to genetic disorders, and as well as the advancement that this technology poses for the medical field, must be balanced with the long-term consequences, with the side effects that may come with gene editing, since this whole medical technology is still quite new. Considering the ethical principles of beneficence and non-beneficence, the potential benefits that gene editing technology can have in, for example, editing out genetic disorders from a child's genome can be quite beneficial, and this technology can also lead to great advancements in the medical field. However, these have to be balanced and weighed against the possible negative consequences of gene editing, which can be things like the long-term consequences that may arise from gene editing genomes, which we're unaware of at the minute since this technology is still quite new. Considering the pillar of justice, we also need to look into the equitable access to this technology in the future. Since this type of technology is very new, has taken a lot of years, a lot of money to be implemented, the chances are only affluent areas will be able to use this type of technology, meaning that they'll be able to have children that may have advantages that the rest of the population don't, which challenges the idea of fair healthcare essentially and fair access to healthcare. Additionally, we also need to look into the integrity of this particular type of technology when we consider the scientific field as a whole, since there aren't particular guidelines in place worldwide when it comes to the kind of research that we can do involving gene editing. So this is also something that needs to be considered. Overall, we need to make sure that we implement guidelines globally that are standardized across all the nations. So we're using this technology in a way that's safe and that's evidence-based as well.
Station 9. Parents should be fined for refusing to vaccinate their children against dangerous illnesses. Discuss the implications of introducing this rule.
So in this particular ethical issue, we have to balance what's right for public health overall, and balancing that with the rights of parents and their choices for their children when it comes to making vaccinations mandatory. To consider the pillar of autonomy, parents are very much in their rights to refuse vaccinations for their children. So first of all, to consider the pillar of autonomy, the parent is very much in their right to refuse vaccinations for their children, even after having been disclosed all the risks that come with that. And however, this decision that the parent makes needs to be balanced with the pillar of justice, where we need to protect the rights of society, particularly the key concept of herd immunity, where we're protecting the vulnerable, children, patients within our society who are more susceptible to infections. And also to consider the pillars of beneficence and non-maleficence. Vaccinations overall are very effective at preventing diseases and preventing the spread of diseases, and failing to vaccinate people, children, can lead to negative consequences, not only for that particular child, but also other children around them who can get the disease as well. So making these vaccinations mandatory, on one hand, it does preserve the concept of justice within our society. However, implementing fines can have negative consequences. For example, penalising parents who, for example, come from less stable socioeconomic backgrounds can actually put them in a worse state and can have negative impacts on other aspects of their life as well. So although mandating vaccinations can protect the key concept of justice by protecting everyone from getting diseases within our society, penalising parents for not vaccinating their children can actually exacerbate healthcare inequalities, particularly if these parents come from very low socioeconomic backgrounds, and adding that additional fine to their list of bills can have further negative consequences for the parent, for the child, and for the whole family. So I'd say having alternative approaches to this, such as, for example, having a lot of vaccination campaigns, really thoroughly discussing with parents, listing all their concerns regarding why they don't want to give their children vaccinations, can be more effective, since we don't want to exacerbate healthcare inequalities, and we don't want to ruin any doctor-patient relationships that we have with the parents, with the families, and prevent them from seeing GP surgeries and us as doctors more for any other diseases they may have.
Station 10. Should patients with severe depression be allowed to make medical decisions about their care?
So the main dilemma here is when we have to consider a patient's ability to make decisions when they have very severe mental illnesses. When we consider the pillar of autonomy, the patient is in their right to make decisions about their healthcare all the time. However, when their capacity is infringed, that's when we have to step in and make decisions in their best interests. In this particular scenario, when patients are in a state of depression or very progressed mental state illnesses, what they might want in the moment might not align with what they would have wanted when they were completely healthy. So when, in worst case scenarios, when a patient is suicidal, their thoughts behind not wanting to stay alive would not align with what they would have wanted, when they were healthy. So in this scenario, we definitely want to assess for the patient's capacity, which would mean that we'd have to, thoroughly understand what their refusals for particular treatments, which would involve us being able to elicit whether they can understand the reasons behind refusing medications, refusing treatments, and seeing whether they can weigh up their decisions and communicate their decisions with us. With the pillar of beneficence, where we want to act in the best interest of the patient, acting in their best interest in this scenario would be to follow their desires when they were completely healthy, as opposed to being in this depressive state. And with the pillar of non-maleficence, we want to avoid doing harm by following decisions that they're making that don't align with what they value as a person as well. And finally, with the pillar of justice, we want to make sure that people, regardless of what mental, disease they have, they are treated fairly, with fair decision making. And finally, with the pillar of justice, we want to make sure that patients, regardless of whichever mental health problem they have, are treated fairly, with dignity and without discrimination as well. So how I'd approach the situation is, like I mentioned, I'd want to assess the patient's capacity and their ability to make decisions about their treatment plans, their healthcare. And if they are, for example, deemed unable to do so by the correct psychiatric evaluations, by the correct healthcare professionals, then I'd want to get into contact with their next of kin, which is usually their family members, children, parents, whatever it may be, so I can gauge fully what the patient would have wanted in their most fit and healthy state. And if I'm unable to do that, then I'd want to see if there are any advanced directives in place regarding their health, or in situations where neither of those are available, then I'd want to get ethics committees and legal action in place in order to do what's best for the patient.